Okay, one.
Start rolling.
Good afternoon, ladies and gentlemen. My name is Hakim, and today we will be interviewing Dr. Vijaya Shankar Jagannathan Naidu, and he is a consultant hematologist. So, doctor, what is hematology?
Well, hematologists are doctors who deal with blood problems. So, hematology is the root word, and we deal with all blood-related issues.
Okay. So, today our topic is blood cancer, also known as leukemia. So, what is blood cancer?
Very good question. I mean, blood cancer is a very generic term. There are two important causes of blood cancer, either leukemia, myeloma, which is a liquid form of blood cancer, or we have a solid blood cancer, we call it lymphoma.
Okay. What are the risk factors of blood cancer?
Well, there are no real proven risk factors, but there are some known associations. You can either be born with risk factors, like children who are genetically prone with Down syndrome, or those people who have been exposed to previous radiation. And I'm sure you are aware of Hiroshima, Nagasaki, atomic bomb, and Chernobyl explosions. They have a higher risk of blood cancers.
Well, what type of cancer is blood cancer?
Okay, as I mentioned before, the most important common ones are leukemia, myelomas, and lymphomas. But the more important that I think is more relevant to you is leukemia, that is actually white blood cell cancer.
Can we avoid blood cancer?
Well, you really can't avoid, but see, you can avoid recurrent radiation associated with blood cancers, although there's never been real data. But if you can try to avoid radiation, you should try to. The rest is difficult because you can be genetically prone to get leukemias or lymphomas because of some environmental factors. That situation you cannot do.
Okay, how does blood cancer affect our lives?
Very good. I mean, you see, when you have blood cancer, you cannot function normally in the time of diagnosis. At the time of treatment, you may not be fit to work, you may not be fit to go to school. And if your parents have got blood cancers, they cannot work and produce money for you, earn money for you. So it's going to affect your life in a way, it will affect your quality of life. But once you go through intensive treatment and show respond, then you should go back to your normal life.
Alright, so what are the treatments for blood cancer?
The general principles of treatment is chemotherapy. Chemotherapy, or we call cytotoxics, basically drugs that are very harmful for cancer cells and they kill cancer cells. And in some group of patients, we use radiotherapy.
Okay, I want to ask you this question. Is there any survivors in this country?
Well, I'm sure there is. Yeah, that's a very good question. 50 years ago, I'd probably say minimal. But this time, we have got very good survivors. There are some cancers, particularly childhood leukemias, the overall survival, that means at 5 years, children survive more than 90%. And some form of adult blood cancers, they have very good results.
Alright, that ends our interview with Dr. Vijaya. Thank you
Thank you very much. It was a pleasure being here.
Alright.